Let's discuss altered mental status, AMS, a broad term used to describe changes in consciousness, cognition, or behavior, which can be caused by various medical conditions. Here are the key concepts that you should know about altered mental status. It can range from confusion, or disorientation, where someone is unable to answer simple questions, to unresponsiveness, where a person cannot respond or react to you, even if you give them verbal stimuli or painful stimuli. Causes of altered mental status include hypoxia, infection, stroke, metabolic imbalances, and many other conditions. In fact, there is a mnemonic that was created to help EMS providers remember the common causes of altered mental status. This mnemonic is called AEIOU TIPS. A reminds us that alcohol or acidosis can lead to altered mental status. E reminds us that epilepsy and electrolyte imbalances can be causes. I reminds us infections, which include things like sepsis, a severe reaction of the body to an infection, or an actual infection like meningitis can be a cause. O is for overdose or oxygen deprivation. U is uremia, often from kidney failure. T is for trauma or temperature abnormalities. I is for insulin, which reminds us about hypoglycemia and diabetic ketoacidosis. P is psychiatric causes and poisonings. And S is stroke and shock. Patients with altered mental status can present with confusion, agitation, slurred speech, weakness, or unresponsiveness depending on the cause. Altered mental status means that a person's mental status is changed or altered. A mental status is combined of two things. One, a person's alert status, which we use the AVPU scale to assess, and two, their orientation status, which relates to the 4 questions we ask patients to see if they're oriented. For example, if we're trying to assess somebody on the AVPU scale, we would see if they are alert, alert to verbal, alert to painful, or unresponsive. To see if they're disoriented, we ask them 4 simple questions related to person, place, time, and event. For example, we might ask a patient their name, where they are, what day it is, and if they know why 911 was called. If a patient is disoriented or unable to answer one or more of those questions, or has a decreased level of responsiveness or consciousness, let's say they're alert to verbal, for example, then they have an altered mental status. Here's a quick tip. Have you ever heard of A and O times 4? The A and the O represent alert and oriented. In other words, you're saying that a patient is alert, they open their eyes spontaneously under the AVPU scale, and they're oriented times 4, meaning that they can answer all 4 of the person, place, time, and event questions. To manage a patient with altered mental status, provide supportive care and treat the underlying condition that you have identified. In addition, you should transport the patient to the hospital. ALS providers may be able to use additional treatments beyond the basic scope. This may include initiating IV access, giving fluids or dextrose, and other treatments. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.